We've done that, sir. We'll try to do some of that really quick. What's that? Sir, do you really think I'm smart enough to figure out what's in that box?
You're not smart anyway.
Kristen Goodall.
Smart?
Kristen?
You know how to spell that
Kathy
word?
next. Kristen, are you still here? Oh, she left.
Okay, go to the next.
Yeah.
Okay. Now we have a Shayna Neal.
Pick another one.
Shayna?
Not here? Okay.
Keep them coming.
So we have this gentleman ready, if you'd like.
We now have Frank Moore.
I want to ask you a question.
Jody,
I didn't think you'd pick it.
Thank you, Mr. Senator. I wanted to refer back to one of your first slides,
okay.
where you presented the prices.
What's your name and where you're
Oh, Bill Hardeman. I live in the North Hills.
Okay.
And one of the early slides you showed several reasons for the healthcare effort. And one was a crisis concerning the cost. The cost was escalating at a high rate, twice normal inflation or more. And you pointed out several times that it could cost as much as, I think, 51% of the average Pennsylvania salary or income.
6 years from now, or 7 years.
In some time, like
Right.
2016.
And I realize that's
So this is a huge problem, and I know everybody's aware of that. We have limited income in many cases. The other thing that you showed as a crisis was the fact that many people weren't insured, and some of those people weren't insured because they had precondition existing, and insurance companies who weren't covering them for years, and then they find out they have an illness coming, they come and ask for insurance, and the insurance company says, that's not fair, because you haven't been buying insurance, and now you want it because you're sick. So what you're planning is you're going to expand insurance coverage for the uninsured, plus guarantee that no matter what your condition is, you'll be able to get insurance and coverage. And yet, President Obama said that this healthcare bill was going to be revenue neutral. And the cost is going up at 15% a year, 8 to 10, whatever the number is. So my question is all about cost. We can't have it all. We can't give insurance to everyone. And yet, you're saying you're going to be able to bring down the cost. So how can we bring down the cost without limiting the services that everybody gets?
Here's a summary of how I think we can do that. And look, no matter what passes here, if anything passes, I think something will pass, I believe. No matter what passes, it's not going to be perfect, and there'll probably be implementation problems that we haven't foreseen on both sides of the argument. But one way the coverage question does help on cost. Doesn't help in the first year necessarily, maybe in the first couple of years, but it's going to help over time, because just like you can keep down in that example with government employees, why do you think I pay a low health insurance premium? Not because the government is trying to.
There you go.
I pay part of it, you pay part of it.
They pay more of it.
Thanks for the correction. But I know you do. I understand. But if you have, because you have such a large pool of people, meaning federal employees, that's keeping costs down, among other things, but that's a principal reason keeping costs down. If we cover, if there's no longer this coverage problem, you're not going to be paying as a Pennsylvania resident that $900 a year, okay? You're paying that. You're paying it right now, in one way or another. So that's the intent of this. That's what we're trying to do, is to cover everyone, not just because it's the right thing to do from a humanitarian standpoint, and it'll have a stronger economy and a better country, but because it can actually lower costs. That is not the only way you can lower costs. Another way you control costs is by revenue. That's what the Finance Committee will speak to with regard to the tax code. Now, put me on record, as I have said innumerable times, I will not come to a shock to anyone here whether they disagree with me or not, that I think wealthy Americans should help pay for this.
Wow.